Hey, I'm Chris Peterson. Welcome to Checkup Prep, your informational video series based on your child's well visit. Probably not a conversation we should be having here at the library. So let's do this. You watch the disclaimer clip, I'll meet you back at the office. Perfect. See you there. While I am a board-certified pediatrician licensed to practice medicine in the state of New Hampshire, this video is meant to be informational only, not an attempt to practice medicine, nor to be diagnostic. It is meant to be used in conjunction with your child's well care visits. Welcome to your 12-month checkup prep visit. Let's start off talking about foods. Now it's time at 12 months of age to introduce whole milk. So giving your baby 24 ounces of whole milk a day. That's not going to be enough vitamin D in the whole milk, so continuing with vitamin D supplements is going to be important for bone health and growth for your baby. Start weaning the bottle, introduce a cup, don't need juice. Juice these days is really just thought of as added sugar. Don't need water either. Most of the water that your baby's going to be getting is from the milk and from the foods that you're feeding. Your baby's making wet diapers, 8 to 10 a day, they're getting plenty of water. We don't need to worry about adding more water. Table foods. Think about tooth acquisition just for a second. Your baby still needs to have the foods in small pieces. You're eating a pizza, for instance. You use your front teeth to rip and pull that piece of pizza. Then you use your back teeth to chew it up. Your baby may have 4 front teeth, but won't get their back teeth until closer to 15 to 18 months of age. Now, of course, we're not going to wait until 15 to 18 months of age to give your baby solids. Once again, what we need to do is just make sure it's small pieces. Things that if it can't chew it up, or gum it up, I guess, then it can swallow it down. Even small pieces of chicken or ground beef well cooked, or steak well cooked, or fish well cooked, any one of those things, but just making sure they're cut up in small pieces because that choking risk certainly is there as we increase the texture, the wholeness, if you will, of the food. We want your baby to get 4 to 5 fruits and vegetables a day. Whole grains are important. I oftentimes think that if you couldn't pull that grain off of a tree, then you probably shouldn't be eating it. I know Cheerios and fish, goldfish are oftentimes given to kids, but I'm not sure that they're the best nutrition for your child. Fruits and vegetables, those are pretty darn good for sure. Eat as a family. Start getting used to sitting down and eating your meals together. That's going to not only show your baby good, healthy eating habits, hopefully you're eating well so that your baby sees what you're eating, but it also will start forming that family unit, which is going to be really important down the line as an adolescent. We know that adolescents that eat together as a family, they're less likely to be at-risk behaviors. But you can't start that when they're 12 if they've never done it before. So starting now, building that as a life process is going to be important for your baby later down the line. Again, that risk of choking, making sure we're watching your child when they're eating. At this age, I wouldn't leave it in a high chair, eating foods and go out of the room. You really need to be eyes on when they're eating because that risk of choking is there. Foods to avoid, now at 12 months of age, there are only 2. We don't want them to get big foods that are chokeable risks, like pistachio nuts or peanuts or those kinds of things that they could get stuck in their airway. And we still want to avoid big fish. Shark, tuna, swordfish would be some of the ones I would think about. But you can certainly give salmon or halibut or haddock, any one of those types of fishes. It's just the ones that are out in the sea for a long period of time because that risk of mercury can certainly increase. So no big fish and no chokeable risks. Developmentally, 12 months of age, they should be saying words. Mama, dada, typically, and again, 85% of kids will say dada first, but mama, dada specific to you guys are some of the words that usually we hear. But 1 or 2 words, could be anything. It could be no, bad dog. It could be anything that you guys are saying probably repetitively, the baby will pick up and imitate. 1 or 2 words. Gross motor, they should be able to pull themselves up to a stand and look out, here they come. They should be walking, holding on to things. We've talked about before the risk of around the home increases as they become more and more mobile. And so now here they are walking, right? And so we hopefully have gaits and those kinds of things up, and we'll talk about that in a sec. But the mobility certainly increases their risk around the home. Fine motor, they should have what we call the fine pincer grasp, finger and thumb, being able to pick something small up, usually put it into their mouth. So being able to get a raisin and put it into their mouth is what we'd expect from a fine motor. And socially, they should be waving or getting close to it, certainly engaging when somebody comes in. They may have stranger anxiety, no doubt, but they should be engaging with the eyes, holding onto you maybe, maybe waving to them as somebody comes in or leaves. Teeth. More and more teeth are erupting every day, I'm sure. And so usually 12 months of age, we have 4 on the bottom and 4 on the top, and we're working on our molars or our eye teeth. Brushing those teeth is going to be important. Making a first dental appointment isn't unreasonable. Checking again on your water source to see if there's fluoride there. Brushing your child's teeth with a toothbrush, taking a small amount of fluorinated toothpaste is recommended. So like butter on your toast, mayonnaise on your sandwich, just a small amount across that toothbrush, and brushing your child's teeth is going to be important for tooth health. Making sure we're not bottle propping, not leaving a bottle in the baby's sleep space to sleep with, because that certainly increases your risk for cavity and decay of the teeth. Safety. 12 months of age, moving around, pulling things down, getting into things. We really need to get down on our hands and knees and look around the room and see what it is the baby can see. Because what looks like a bookshelf to us is actually a ladder to them. Or if you see drawers that are pulled out in stages, it's a set of stairs. And so the problem is they can get up onto that and weight it, and then the whole thing comes down onto them, and we have a bad toddler accident. And so we want to definitely try to avoid having things that they can get to, making sure that furniture is attached to the wall so they can't weight it and pull it down on top of themselves. Window guards on, making sure we're opening the windows from the top so they can't tumble out. Cabinet locks, gated stairs, all of those risks that we've talked about before, poisons, matches, medicines, knives, weapons, making sure those are all secure from your baby. Pools, ponds, and other water safety with mobility. If you have a pool at home, the only way you can keep your baby safe is to make sure we're watching them when they're around the water, limiting that access, making sure that gate works so that it's closing tight and they can't get into the pool. In the home, water less than 125 at the hot water tap, smoke detectors, carbon monoxide detectors, keeping away from secondhand smoke. If you smoke, I beg you, please quit for your own health and for the health of your baby. Avoiding sun exposure, using sunscreen when you need to, using bug spray, but avoiding bugs certainly is going to be important. And then thinking about safety around things, around the street. Mobile baby can get off into the roads, being careful there. Around dogs, around lawnmowers, all of the things that you may be doing now with your child, being outside and you being active around poisons and fertilizers and those kinds of things, making sure we're being very cautious about where the baby is when we're out doing things that we need to get done. Also, loud noise protection. You know, I think about bringing your baby to the monster truck show or off to the races for on the weekend. But those noises are loud for a baby's ears. They're much more sensitive than ours, so making sure we're using hearing protection, a little baby headset in order to try to reduce the noise or even avoiding that noise altogether. Poison control. If your baby gets into something or you're worried that your baby's gotten into something, give them a call. 1-800-222-1222. Once again, 1-800-222-1222. If you think there's even a chance that there's been an ingestion, give them a call. They'll give you the guidance that you need. Final safety piece, car seat. Still, that rear-facing car seat until the age of 2. 5-point restraint, back seat being the safest place, rear-facing till the age of 2. So we keep them rear-facing for a whole nother year. I know their legs may be bent up. The experts say they are still safer in that rear-facing position. I joke about the fact that it's so safe I drive my car backwards because it's safer to be rear-facing. Let's talk about activities. Things your baby's going to like. Your baby's going to like you to be interacting with them, modeling talking for them, praising their good behaviors, reading with them, singing with them. Even if you don't have a good voice, it's okay. They don't mind. Sing with them. Read interactively. Point out pictures. Get them to point to things that they may recognize. Giving them individual attention. Blocking other things out and focusing in on that child. Get rid of your phone. This is the only time they want you to be around this much. So spending time with them. Having said that, they should also be able to play independently by themselves. So encouraging them to do their own self-play is important. But like I said, play with your child, explore with your child, listen to your child. I know they're not talking a lot, but they should be doing some proto-declarative expressions, pointing at things or expressing what they do or don't want. So making sure we pay attention to that. You don't have to always give them what they want, don't get me wrong, but showing that you're engaged with them, showing them affection, and limiting the electronics for them, TVs, videos, games, those kinds of things they just don't need. Behavior, I would continue with some limited but consistent rules. We don't need to use timeouts yet. We're just going to really use distraction. Don't pull on mommy's hair. That's not nice. That hurts me. Moving the hand down. Don't pull on daddy's beard. That hurts me. We don't want to do that. So redirection with their negative behaviors, but setting those boundaries and keeping them consistent. Encouraging them to self-calm. So if they're frustrated with something, giving them the resources of saying, let's put that away for right now. Settle yourself down. Let's take some deep breaths. Take some time to stop crying before we move on to the next. Helping name expressions, joy, anger, sadness, fear, frustration. That'll help your child later know what those are. They're going to experience them, but giving them the words to experience them now will be helpful to define them and manage them later. Expect genital exploration, especially with boys. I'm just going to leave it there, but expect them to be exploring. For you, let's make sure we're spending time with your spouse, as a couple. Let's make sure you're taking time for yourself, getting your sleep, staying calm, make sure we're using polite words and resolving conflict in a good way, making sure we're not modeling bad ways to deal with frustration and anger. Your baby's watching you with all the things that you're doing. You are making the entire view for your baby's world. They see it all through your eyes. No pressure. And you don't have to be perfect. That's not the point. But trying hard to do the things that you can to show that that the world is a good place for your baby. Enjoy your baby. Stay centered. Stay balanced. We'll see you next time.